follow-up numbers, community services, St. Rose numbers. And on pages 5 through 13 is information about caring for yourself postpartum. On page 9 is an important page on emotional changes, baby blues, and postpartum depression. Are you filming me?
That way you can play it back and not miss anything.
Actually, we can put that on the Get Well Network. No, I'm kidding.
She didn't like that idea.
Okay, and then the green box is symptoms of postpartum depression, what to look out for. A good rule of thumb is if you feel any loss of control, if you feel like harming yourself or someone else, that you please contact your OB doctor. Every mom should follow up at least once in 6 weeks, and if you had a vaginal delivery, it'll be the first time between 1 and 2 weeks for an incision check, and then again at 6 weeks, and if you had a vaginal delivery, it'll be between 4 and 6 weeks. So in your room, your nurse will give you all your personal information, specific information for you, your baby, your prescriptions, your Nevada WebIZ form, metabolic screening forms for the baby, anything that you need to sign, take home, anything that's pertinent to you and your baby you'll receive in your room. The best advice I could give you is to sleep when your baby sleeps. That is so important. Those of you who have other children, you probably already realize that. You're about to go through a lot of sleepless nights. So whenever you can get an hour here, an hour there, please take that time to rest. Put your feet up, close your eyes. It's going to be a long time before you get a full 8 hours rest. So an hour here, an hour there. If you just need some fresh air, get outside for a few minutes. Accept any and all help, anybody who's willing to make a meal, clean your house, watch other children, or just allow you to nap or whatnot, accept it. So that's just a side note on that. You're welcome. Okay, continuing on, feeding your baby is on pages 15 through 33. There's a great breastfeeding section, and on 33 is a tracking record. The first week, it's very, very important once you leave here that you track your baby's pees and poos and how much baby's eating, especially if you're breastfeeding. If you are breastfeeding, you should be feeding at least 8 to 12 times in a 24-hour period. So that's approximately every 2 to 3 hours, 15 to 20 minutes each breast. That's making sure that your baby's getting enough to sustain itself until your breast milk comes in between days 3 and 5. What you need out minimally, the first day of life is 1 pee, 1 poop. The second day of life, 2 pees, 2 poops. The third day of life, 3 of each. Fourth day, 4 of each. Day 5, 5 pees, 5 poops. And by day 6 and onward, you want at least 6 wet diapers and at least 1 poop in a 24-hour period. That's very important to remember. So just think of the day of life, you want that many pees and poops. And by day 6, at least 1 poop in a 24-hour period and at least 6 wet diapers in a 24-hour period. By day 5, every poop of your baby should transition from black tar to yellow seedy if you are breastfeeding. And if you are bottle feeding at all, it'll be more curd-like and thicker. So that's just a difference in the stool. But every stool should transition to yellow by day 5. If your baby's still having any type of black in the stool, your baby's probably dehydrated, jaundice, not having other issues. So it's very important that you're watching your baby and tracking. That first week, your pediatrician, you will see your pediatrician. Today is Saturday, so before next Friday, everyone should have seen a pediatrician. That first pediatrician appointment, have someone take you so they can do the carrying of the carrier. That's too heavy for all of you that first week or so. And at that first visit, they'll tell you that your baby, how your baby's transitioning at home, if your baby's gaining, getting enough to eat, hydrated, etc. So that first one is very, very important. In your room, your nurse will tell you when to follow up, whether it's Monday, Tuesday, Wednesday, Thursday, or Friday. It's going to be one of those days, though. So that's that. Any tracking record you want to use for pees, poos, and feedings, this is just an example of one. We give you the square sheets in your room. There's also, in the breastfeeding magazine, that the lactation girls give out. There's another form of a tracking record in there. As far as caring for your newborn, that's on pages 35 to 45. When to call the pediatrician, very important, page 43. Baby's warning signs and reportable symptoms. If your baby turns blue, please call 911. If your baby, for whatever reasons, not responding, pick up your baby, stimulate them by rubbing their back, tickling their toes. You could use an alcohol pad on their umbilicus or belly button area. If they don't respond, please call 911. If they start crying, of course, look at your baby, see what's going on. Call your baby if something call your pediatrician if something doesn't feel right with your baby. And this list is a good guideline. So make sure that you ear leaf that page for you. On the opposite page, 42, is the immunization schedule that the Clark County and your pediatricians go by. And bring your Nevada WebIZ form for your baby to each and every well baby visit for the pediatrician, and they will vaccinate baby as needed. The hepatitis B vaccine is given here in the hospital, and there is an information sheet in the free leaf papers that I handed out. So if you have any questions on that. Metabolic screening is very important. Newborn screening could save your baby's life. Brochure on the back are the conditions identified by newborn screening. We do one screening here in the hospital before discharge. The second one is done between 7 and 14 days of age of your baby. Usually you're not following up with your pediatrician at that time, so we have you come back to the hospital. It's free, it's a part of your hospital visit. You bring the paper that we have you send in the room. It's a consent that, yes, I will bring my baby back. It will have a window period of time of when to come back. So for instance, it'll say 1/27 to 2/3. Between those days, anytime, Tuesday through Saturday, 7:30 to 5:30 p.m., you can come back to the hospital. They'll poke baby's heel one last time, and you'll be done. Where you go, come to the roundabout. You need some help? Come to the roundabout on the first level, go to the volunteer desk, they'll walk you back to the outpatient lab, and they'll poke baby's heel one last time. No news is good news, so if you don't hear anything, your baby's fine. And no appointment is necessary, you just come in. And Tuesday through Saturday, it's 7:30 to 5:30. There's also a friendly reminder card that is supposed to help you. Remember, when you get home, put all this information on your refrigerator. A nurse should call you about a week out to remind you to come back for this test, and she'll also ask how you're doing at home, if you have any questions, etc. So that's very important. You'll also get a white and pink lab slip that goes with this. Breastfeeding support services. Everyone should have seen a lactation person at least once while here in the hospital. If you have any questions when you go home, all the information's on the back of here. There are 2 centers here in the Valley. The closest here is Green Valley and 215. It's in the St. Rose Parkway Plaza. It's the Barbara Greenspun Women's Care Center of Excellence. It's on the 3rd floor, and they can help you with a nursing bra, sling, pump rental, purchase, anything you need in regards to breastfeeding, they can help. So that's available to you as well. Food and Drug Interaction booklet, that's for your information. Please continue to take your prenatal vitamin for at least 6 weeks and for as long as you are breastfeeding. Okay? Motrin is the most commonly used pain medication after having a baby. It's a non-steroidal anti-inflammatory. Always eat with it. The #1 side effect is gastric upset or nausea. Eating with it will help it work faster and prevent nausea. So take that around the clock for at least the first few days, the first few weeks, depending on how much pain you're having. It will prevent a lot of the breastfeeding pain, cramps associated with breastfeeding, and any mild incisional pain or lacerations, repairs, episiotomy pain. For more severe pain, you'll have a narcotic ordered. It's usually Percocet, Lortab. For those medications, always eat with them. The #1 side effect is gastric upset. It may cause constipation, so make sure you increase your fluids and your fiber. And also, don't operate machinery, drive, or drink alcoholic beverages because it may cause sleepiness. So any other medications you may be on, we'll be discussing in your room, and your prescriptions will be given at that time as well. Smoking cessation, are you ready to quit smoking? We have to give this to all of our patients. Please, no smoking around your babies. Car seat safety, please make sure you bring your car seat carrier up to the room. Does everybody have a car seat? Bring that up to the room. We'll make sure you know how to safely put your baby inside it. As far as base installation, family to family connection, we'll check that for you, or the Women's Care Center. The numbers are here in your packet, on here on the lower right-hand corner of that if you need to get that checked. And they'll do it for free. Just give them a call, they'll get you right in. Birth certificate application, you should have received in your room at this point. If you haven't, they will be by today. Just let me know and I'll make sure that they get by if they haven't already. Somebody from medical records will stop by, give you a pretty lengthy packet about you, your pregnancy, the father of the baby, your baby, and for those of you not married, a declaration of paternity. Please look all this paper over. If you have any questions, ask us. Fill it out to the best of your ability. We must collect this before you go home at discharge. If you don't turn it in, we don't have proof that your baby was born. You won't receive a Social Security card or a legal birth certificate. So it's very important that we at least get that information. About a week or so, we'll process it. You should receive in the mail a preliminary birth certificate. It'll have the St. Rose emblem on it. Look it over, and if everything looks correct, accurate at that time, you would fill out the birth certificate application in your packet here. You could either fill this out, send it in, or you could do it online. Either way, you should receive your legal birth certificate and Social Security card for your baby in about 6 to 9 weeks after you receive the preliminary one in the mail. Any questions on that? Okay. Jaundice. Jaundice is very important to monitor in your baby. Jaundice is the yellowness of the skin, whites of the eyes. If you notice that your baby is jaundice, is irritable, you can't calm your baby down, you can't wake your baby up. If baby's lethargic, having a temperature, respiratory distress, not feeding well, not getting your minimal output for that first week, and you're noticing all of these signs and symptoms, please call the pediatrician. Very important. Jaundice can lead to brain damage. There is a mandatory video in your rooms that you must watch before going home. It's 7 minutes long. It just shows you how important it is to prevent jaundice, and it's very preventable. So that's that, and there's a information sheet front and back in your packet. Family to Family Connection, that's a community resource available to you. It's located adjacent to the older St. Rose on Lake Mead and Boulder Highway. There's a calendar and an information and eligibility form in your paperwork. I think I covered everything in there. Any questions on what I handed out? Okay, moving on to mom. It takes about 6 weeks for your uterus to completely involute or go back to normal. In that time period, you will have bleeding similar to or slightly heavier than your period. When to call the doctor. If you are soaking more than 2 pads in 2 hours or a pad an hour, if you are passing any large clots larger than your fist, save the clot, call the OB doctor. If you have a fever of above 100.4, chills, nausea, vomiting, diarrhea, severe pain not relieved by your medications, chest pain, leg pain, severe swelling that's getting worse and you're starting to lose feeling in your hands, your feet, anything like that, urinary frequency, urgency, foul smelling or cloudy urine, any type of incisional drainage, yellow, green, foul smelling, redness, edema at any incision sites or opening of incisions, call the doctor. Anything that doesn't feel right, seem right with you, any loss of control, please call your doctor. For vaginal deliveries, please keep that area clean and dry. No straining, so increase your fluids and your fiber. Use your Tux, your Dermaplast spray. You can also use that SITS bottle, fill it with warm water after you use the bathroom, and pat dry. Any type of stitches down there, those should absorb and go away on their own. You shouldn't have to go in and get them removed or anything like that. For C-sections, you want to monitor your incision in a mirror. If you notice anything opening up, yellow, green, foul smelling, anything like that, call your doctor. Wear your binder whenever up and about. Hold the area in whenever you cough, sneeze, or laugh. No twisting or turning. And pick a floor if you have stairs in an apartment or a home. And go up and down one time in a 24-hour period, at least for the first few days, the first few weeks. Rest. No house cleaning, vacuuming, running, lifting, no lifting anything larger than your baby. No exercise plans, just relax. Okay, the first 6 weeks you need to relax, bond with your baby. The only activity you should be doing is walking, and that's a stroll around the neighborhood, no speed walking. And then Kegel exercises, which are strengthening of the pelvic floor muscles. That's it for 6 weeks. For all deliveries, showers only, no tub baths, pools, or jacuzzis, and that's to prevent infection. And pelvic rest, which means nothing in the vagina, no tampons, douches, intercourse for 6 weeks. And that's also to prevent infection. At 6 weeks, at that follow-up appointment with your doctor, you will discuss with them family planning, contraception, but until then, nothing in the vagina. Let's see. Diet for recovery means no dieting. So lots of everything you've been eating and more: protein, calcium, whole grains, vegetables, lots of fluids so you can recover. For those of you who are breastfeeding, no dieting for as long as you are breastfeeding. So make sure that you're feeding yourself well, so your baby's not depleting your stores, and so your breast milk supply is full for your baby. The first month, you're really trying to build up that milk supply. So anything you introduce into your baby's mouth may impact the milk supply. So supplementation, pacifiers, etc. Just keep that in mind. If you're on the fence on whether to introduce those items, it may impact the milk supply. So breastfeeding's based on supply and demand. However often baby's on your chest, that's how much milk you'll produce. Between days 3 and 5, your breast milk supply or your breast milk should come in, and when that happens, your breast will be firm, uncomfortable, continue to feed. If your breasts are too firm to get baby latched, what you can do is use warm packs, or you can take warm showers. Or if your breasts are too firm to get baby latched, you can fill a basin full of warm water. By leaning into that, the gravity, the warmth should help the milk leak out, and baby should be able to latch a little bit easier. For sore nipples, you can use lanolin until that breast milk comes in. Once the breast milk comes in, you just express a little bit of milk after a feed, and that's more soothing and healing than the lanolin. If you do use lanolin, use a small amount on the nipple after a feed, and you don't have to remove it prior to the next feed. Another warning sign to call if your breasts are red after your milk comes in, if you're having fever symptoms or any streaks coming from the breast, call the doctor. That could be mastitis. Any breastfeeding questions, just know that there is help out in the community. You can call the lactation center, lactation centers, and pay attention, look at the diapers, the wet and poo diapers, and keep track of how often you're feeding your baby. And remember, 8 to 12 times in a 24-hour period is normal. Any questions on mom or breastfeeding? I know it's a lot of information. Okay. Moving on to the baby. Everything in the bassinet belongs to you. Make sure you clean it out except the linens. Take the crib card, the hearing screen certificate, bring that to your pediatrician. That information will be valuable to them, and it's proof that your baby was screened for hearing while in the hospital. Wherever your baby's at, make sure that they're on their back to sleep. That is the American Academy of Pediatrics recommendation. And no extra blankets, stuffed animals, anything that can include the airway, mattress, bumper pads, anything like that. Wherever baby's at, make sure that green bulb syringe is out and accessible. If your baby's choking, gagging, pick up your baby, head up, feet down, pat pretty firmly on their back. If that doesn't get it out, at that time you would use the bulb syringe, compress it prior to entering the side of the mouth, release. It's a gentle suction. Get rid of whatever's in there and repeat until whatever's in there is out. Okay? Like I said, if your baby turns any colors, pick up your baby, gentle stimulation, no shaking, but gentle stimulation to get them to respond, cry, etc. Normal respirations, you don't have to count, but some parents are nervous and they want to know. Between 30 and 60 breaths per minute is normal, and what you can do is unclothe the chest, watch it rise and fall an entire minute, and that will let you know if your baby's respirations are normal or breathing is normal. That cord stump we remove before you go home. Here in the hospital, we have you use alcohol on that cord. At home, you don't have to use alcohol on the cord unless it's soiled. So if it gets dirty from a poopy diaper or anything like that, go ahead and use alcohol or use soap and water. Sponge bathing only until that cord stump falls off. And that's just to prevent it from opening up in a place where baby can bleed. And it should fall off between 7 and 10 days. Sometimes 14 days, but a week or two it should fall off. Those of you who have little boys, circumcision will be discussed at the first pediatrician's appointment, and it's usually done at 14 days or 2 weeks of age. We talked about breastfeeding, formula feeding, and preparation. That'll be discussed in your rooms. Make sure you do come back between 7 and 14 days for the newborn screening or metabolic screening. Monitor your baby for the jaundice. Keep track of the feedings, the pees, and the poops. Bring that car seat up to the room. And also there is a temperature probe in your bassinet. Always check it under the arm, which is axillary. If it's above 100.4, call the pediatrician. They'll have you perform a rectal temperature. How you do that is use this water-soluble lubricant on the tip, advance it in the rectum, just past the metal tip. In about a minute it should sound, and that's your more accurate temperature. So that's just for your information on that. And please go to every well baby appointment. At those appointments you'll learn quite a bit of information about how your baby's doing, tips on what to do to help baby, help yourself, etc. And then also baby, bring that Nevada Web IZ form, and they'll vaccinate baby as needed also. Any questions? Okay. Thank you all for coming to the class. Thank you for coming to St. Rose to have your babies. Congratulations to each and every one of you. This is an exciting time. Try to enjoy it. It goes by so fast. Okay, thank you. Thank you.